Hello guys, I am going to explain about the types, clinical features and management of the renal stones. In that management, I am going to explain about the conservative management. There are other surgical management also. I upload in next session. Let's start. There are types of renal stones. There are many types of renal stones are there. In that particularly four types are most common like oxalate stones are 75%, phosphate stones are 10 to 15%, uric acid stones are 5%, cysteine stones are 2%. Other like xanthine stones, urate stones, indigo stones and steroid stones also there, but incidence is less. Next one is the oxalate stones. These are also called as mulberry stones because they look like a mulberry, like brown in color, like sharp projections as seen in the pic picture, and they are invariably calcium oxalate stones only. Shows the enveloped crystals in the urine. They are enveloped crystals seen in the urine. Next one are the phosphate stones. These are actually occurs when infection occurs. Like it is either calcium phosphate, magnesium phosphate, or ammonium phosphate stone. These are smooth and white in color. In alkaline urine, it enlarges rapidly, filling the renal calyces, taking their shape. Because of that only, they look like staghorn calculus as seen in the side picture. These are radio opaque. Remember, it is a radio opaque. Next one in the uric acid stones. These are especially occur has in the urine metabolism problem like altered purine metabolism. She has I like in gout and hyperuricosuriya. These are radiolucent, smooth, hard, and yellowish multiple. As morphological, these are smooth, hard, yellowish, and multiple. Next one is the cystine stone. This is also occurs in the any metabolical problem in the cystine, like occurs in the cystinuria, defective absorption of cystine from the renal tubules. These are seen in the autosomal recessive and form in a acidic urine. This one is seen in the acidic urine because cystine is soluble in the alkaline urine. When acidic urine occurs, these cystine stones will form. These are soft and yellow. These are radio opaque, as it contains sulfurs also. Next one is the xanthine stones. These are relatively less presented in the clinical cases, but these are important also. These are rare, smooth, brick red. Deficiency of the xanthine oxidase enzyme is same. Next one is the steroid stones. These are compound of magnesium, ammonium sulfate, phosphate mixed with the carbonate. These are especially occurs in the urinary tract infection because organisms like Proteus and Klebsiella, they what they will do is in presence of ammonia and urea they split into ammonium form. Because of that only uh, the shape of this looks like a struvate kidney stone. It's a radio opaque. I hope you got this point. Like they are associated with the chronic urinary tract infections because in presence of ammonia and urea splitting organisms in urine. Because of that only they occurs. Remember that part. Next one is the how shape of stone crystals appears like a calcium oxalate monohydrate, like looks like a dumbbell shape. Calcium oxalate dihydrate looks like envelope shaped. Uric acid is yellowish of varying size, and these are varying size. Cysteines are hexagonal, very soft stones, and triple stone is coffin lid shape. Next one is clinical features like renal stones. Of course, they cause the renal pain located over the renal angle, hypochondrium, and lumbar regions. The type of pain is severe type of pain. It is radiating to the groin and testis in the male. And vomiting also occurs because of pylorospasm, and pain worsens on the movements. Next one is the hematuria is also common. Pyorrhea due to the any infections where pus in the urine seen. Next one is the fever because of infections. Tenderness in the renal angle. You should know the tenderness in the renal angle also seen because with often a mass in the loin due to the hydronephrosis, which moves with the respiration and is bimanual, palpable, volatile, soft. smooth and pause. They especially they try to say that it is a hydronephrosis. When hydronephrosis occurs, tenderness in the renal angle is seen. Next, unit infection, sometimes incidental findings, often hypertension also. So we see the stones. Next one is the management. Investigations like blood investigation, urine investigations are done to identify the etiology of that, like any parathyroid hormone, to check the any parathyroid hormonal disturbances causing the calcium metabolism impairment. Because of that renal stones are formed, like that they said. And urine also calcium urate cystine metabolism impaired, like cystinuria causes cystine stones, like that they are saying. But the main investigations we do is the first one is the ultrasonography. Next gold standard one is the CT scan. These two will reveal the whether a patient has the renal stones or not. CT scan is more accurate, and it is a gold standard one. Next one is you do the X-ray to see the kidney shadows also, and others IVU to see the renal functions, and RGPs also we do, and urine analysis to identify the any bacteria. Okay. Next one is the treatment part. I am going to explain only about the conservative treatment. Other surgical approaches are there. I will upload in next few days. Okay. Next, first one is the IV fluids. We give for IV fluids. Next, injection furosemide 60 to 80 mg per IV. Next is anti-inflammatory and antispasmodic agents are given to relieve the pain. Thank you so much.